All right, so we're here today on a February day in 2019 with Dr. Joe Heyman, who was president of the Massachusetts Medical Society in 1996 and 97.
That's right.
So tell us about your year as president and your years as an officer. What were the kinds of things that you were focusing on?
Well, it was the time of the beginning of HMOs, pretty much. They were really starting to develop and take over. And I was particularly concerned about the ethics of, when we were in training, although I don't know how old you are, but when I was in training, it was very important to care about the individual patient. You didn't look at society in general. You didn't look at populations.
Right.
You cared about that one patient, and you viewed yourself as an advocate for that particular patient. And when HMOs came, of course, we were concerned about the general cost of care, and the idea of capitation developed, and the idea that primary care physicians weren't paid enough as opposed to specialists, and that there ought to be some way to empower the primary care people. And of course, when I started, an OBGYN was a primary care doctor for a woman. And, if I saw a woman in the office who had an elevated blood pressure or something, or diabetes, and she was just a regular GYN patient, I would just refer her to an internal medicine person or a family practitioner to take care of that particular issue. But she would just come to me once a year for her annual visit. And if she didn't have an illness, I was basically her primary care doc. If she had a cold or something, I would just treat it. When HMOs came, one of the things that happened in my practice was we had one very large practice that had joined one of the HMOs, and they had a big building that they built that had empty space for physicians, and they called us up and told us they'd like us to rent space in their building and to give them a 5% discount on the one particular HMO that they were in on, and then they would be willing to refer patients to us for all our patients. Otherwise, they would have to confine themselves to physicians who cooperated.
Right.
So that was my first instinct and my first understanding that there was more to this HMO business than met the eye.
Right.
On the original development of it.
So health maintenance organizations were sort of transforming your world.
So when I became president, having watched previous presidents, I knew that if you wanted to get anything done as president, you had to get it done in the first 6 months, and that before the interim meeting. Because once you got to that, the next president was sort of starting to take over. So the other issue with HMOs was patient privacy. So I started these two task forces on day one. One was on ethics and managed care, and that was managed by Mary Lou Bizey. Mm-hmm. And one was on privacy for patients, and that was managed by Charlie Welch. Those were the two chairs of those task forces. And I insisted that they work over the summer. And actually, at the end of my presidential year, the staff sang me this song to the tune of Under the Boardwalk about how they had to work all summer long when most of the time that's when they would take vacations. Uh-huh. So it did leave an impact. But anyway, both of those task forces published pamphlets afterwards And we used those pamphlets in the legislature to get patient protections for both privacy and for ethics and managed care. So those were two very important parts of my year. Another thing that started in my year was the Massachusetts Medical Society and Alliance Foundation. That began also in my year. Another thing was we had I started a task force on ethnic diversity, which I believe is still around with a different name now. But in any event, I was very proud of that task force. And we also started a committee on social action. And I don't know what's become of that. But it was a committee that looked at basically what do you call the
Social determinants?
social determinants of health, right. It looked at the social determinants of health and tried to address how you could address them as a profession. Another thing that we did in my year, I made a little list. We had a lot of wonderful presidents, certainly after I was president and many before I was president. But I've always felt that the most important president to the Massachusetts Medical Society was Rusty Van Houten. He was a tremendous mentor to me. And he mentions in his interview, which I looked at before I came, he mentions that, but he doesn't really go through the details of how important this was. He would bring in the staff for a particular problem on a Wednesday afternoon, and he would have the most junior person on the staff give their opinion about how to solve the problem. And then he would slowly move up until he got to the EVP and got that information. Then he would go to the vice president and then the president-elect, and then he'd make a decision. He would listen to all that stuff, and then he would make a decision based on what he heard. And I thought that was such a great way of, showing leadership on the one hand, getting all the information you need, not making it so that anybody felt that they were contradicting somebody who was senior to them,
Right.
that might be threatening to them. I just thought it was great. And one of the ingenious things that Rusty did, which I think changed the entire environment between state government and the medical society, was that they had passed a profiling law where they were going to just put everything there was to know about a physician up online without any explanation,
No context.
with no context, and it actually passed. And we got Governor Weld to veto the law. And he said, okay, he's going to veto it, but we damn well better come up with something that he can sign. And Rusty and Michael Kelly, who was the general counsel at the time, they put together this law that really did put everything in context. And the initial newspaper articles about us introducing and actually standing up for this thing were very skeptical that we would really try to fight for this thing. But we did fight tooth and nail to get the thing passed. And all of the credit really belongs to Rusty and Michael. But it got passed and signed in my year. So I was the guy who was on all the national morning television programs and all that stuff. And, I was getting credit for really Rusty and Michael's tremendous accomplishment. And of course, now almost every state in the union, they have profiling, and
Right.
it's in context. that was another thing that happened in my year. Another thing was we owned the Mass Pro, the peer review organization for Massachusetts. And my impression had been over the years that it just seemed to be doing nothing. I could not understand what was going on there.
Right.
And I had previously hired Paul Breslin from the Bristol Group to help us with the reorganization of the medical society. And so I hired him again to take a look at the Mass Pro. And after, discussing, he went, he interviewed all the employees and all the people that they contracted with, and basically came out with the feeling that it really wasn't accomplishing what its mission was. And
Right.
most people who worked there didn't even know what the mission was.
Right.
So we changed the structure and function of the Mass Pro, and we hired David Blumenthal, who later became the head of CMS, the Mass,
Right.
to run that program, and he did a very good job, and it changed over the years. Another thing that happened during my year was we purchased the land that we're all sitting on right now from the Polaroid Corporation. And Charlie Welch was head of the building committee, and there was a lot of resistance to making that switch from our previous location in Waltham, which was not far from here. And I got this ingenious idea to take all the people that were against making the purchase or changing our location and putting them on the committee.
Mm-hmm.
And I was thinking, first of all, they might have some buy-in, but on the other hand, if they had some serious concerns, it probably would do us good to be able to address those concerns.
Mm-hmm.
And we hired a consultant whose name was Paul Griesmer, I believe, and he addressed those concerns. I remember two very important members of that committee were this fellow Jim Cotter, who's now passed away, and Franny Rocket. They both initially were opposed to making the change, and they made tremendous contributions by asking really difficult questions of this guy. And we ended up making a recommendation, I believe it was a unanimous recommendation, to purchase this land following that process. So that was good.
So that, you point out a couple of things here. One is that the medical society has grown significantly. When we interviewed Dr. Rodke, he was talking about being at 8th the Fenway, which was a very modest office and a staff of single digits. And then we expanded to the previous Waltham office, and now we are in a facility that is, I believe it's 80,000 square feet.
Yeah, it's beautiful.
And it's beautiful. And so the medical society itself has evolved and grown substantially.
Right.
Much of it while you have been a member.
True, very true.
And the focus of the medical society has evolved, as has yours, because one of the things you said initially was you're a doctor and you're used to seeing patients one at a time and thinking about them one at a time. And this whole business about systems and everything isn't something that we are socialized into. In fact, quite the opposite. We're bred to be a little skeptical about making decisions for the group when you've got the individual in front of you. You certainly evolved on that, and you've been a member of the medical society and have brought the sort of values regarding concerns regarding ethics and privacy on the one hand, and also the notion that systems are out there and they need to be dealt with.
Yeah, that's true, although I have to admit to you that I'm still not happy with the way things have developed. I think from a patient point of view, the consolidation of these practices is not good. It's like a circus for patients, I think. And, one of the things I know later on we're going to discuss, how things have changed in a typical doctor's day. But when I started out in practice, I would make rounds every morning at the hospital. And the beginning of rounds started with coffee in the library or the lounge with a bunch of other colleagues who you could ask questions of, you get history from, you heard about interesting cases they had or interesting articles they read. And there was just tremendous collegiality. When I go to my hospital's lounge now, I'm the only one sitting in the lounge if I go to the lounge.
Right.
So that has changed dramatically, and I think it's a product of HMOs, consolidation, hospital ownership of practices.
It's an industrialization of medicine.
Yeah, and also the hospitalist idea. Now there are laborists. I mean, I'm getting old, but I personally would like my own doctor, not my own system. I want a doctor.
Well, you're talking about the issue of the narrative of life, the narrative of the profession, the narrative of the physician-patient relationship is being de-emphasized as we look more towards checklists and process and productivity.
And it's a shame because, there's no question there are some tremendous benefits from the change. I mean, there's more consistency in quality, for example. And maybe there's some cost savings, although I'm not sure that there actually is. But in any event, and of course people think about cost, which we didn't think about much then. Unless the patient didn't have any money, in which case we thought a lot about cost and we tried to figure out a way that we could get this patient care. But I think on the balance, I'm not sure that we went in the right direction. But we'll have to wait and see. And in any event, it's inevitable. So we need to figure out a way to live with it and make it work better.